Dr. Mark Gonzalez, and I'll be talking tonight mostly about hormone replacement. We are going to mention a little bit about weight because people usually this time of year are starting to rethink diets because of their New Year's resolutions. So we'll make sure that we talk about that as well. And also we have the pleasure of having Dr. Nicole Garcia. She practices in Anaheim Hills, and her information is here if you want. She works with a lot of bioidentical hormone patients, so if you're looking for a doctor, if you currently don't have a practitioner that you're working with, she's an excellent doctor to work with. She's very knowledgeable regarding this subject. And at the end, she'll also be talking a little bit about what she does and weight management as well. So tonight is for you. Tonight is not for us. We've done this several times before, and I always want to tell the patients that show up that I want to make sure that we cover the topics that you want to cover. So most people come here with the idea that they're going to have a few of their questions answered. So I want to just see if anyone can raise their hand and let me know, is there any specific question or anything that you want to make sure I cover regarding bioidentical hormones? Because it is a very controversial subject. I mean, hormone replacement in general, you hear a lot of things in the news, you read a lot of things on the internet, you buy books, and all these different, you're getting information from many different sources. So we want to make sure that you get your questions answered. And you have a pharmacist here tonight, you have a physician, so I think definitely we'll be able to cover the bases. Any questions that you guys have to start off with?
I have one on use the saliva test versus any blood test.
Okay.
I'd like to know
The difference between those two? Okay, we'll definitely make sure to cover that. And with our pharmacy, we definitely do use both. So we offer saliva testing. We can't do blood testing at the pharmacy, but if you were to come in with blood tests, we'll go over them with you. I do prefer the saliva, and I'll make sure to mention why I have a little bit of a preference there. Anybody else have any questions?
I was just wondering, I noticed another compounding pharmacy closer to my house.
Sure.
Do all compounding pharmacies do the bioidenticals?
You're going to find most compounding pharmacies will work with bioidentical hormones. I've yet to see one that doesn't.
Oh.
Now, I do think that there are differences between compounding pharmacies, just like you'd find with any other pharmacy. And I'll make sure to cover why, what sets us apart. Because every pharmacy is going to have something that makes them unique. And when it comes to hormones, I'll let you know what maybe sets us apart from any other
The
company.
only difference is my insurance.
Sure, your insurance
Is the one, it lists the other one, I noticed, but it doesn't list you
doesn't
guys.
list us. Correct. So I'll make sure to go over the differences because there are some reasons why I think patients, and we don't take most insurances. Well, patients can submit a claim form, so we do give you a claim form that you can submit to your
Yes, I
insurance.
do that, but
And,
it takes time.
Oh yeah,
Yeah.
it does. But I'll let you know the differences and why I think, why I think we're above the rest. Anyone else?
What is the actual ingredients in the compound?
Okay, in the bioidentical hormones. Okay, so what the ingredients are in the bioidentical hormones? And it's not. Oh, okay.
what makes it bioidentical.
What makes it bioidentical? Okay, so I'll make sure to cover all that, and in between we'll also be talking a little bit about weight loss. Weight loss is something that I'm very passionate about because it's something that I struggled with, and I think for those of you that have struggled with weight, it's not it doesn't end. I mean, when you lose weight, it's not like, okay, I've won the battle. It's kind of an ongoing thing. I love food. I always have. I grew up in a home where I don't know, I'm going to say typical Hispanic home, maybe I'm wrong in saying that, where you say that you're hungry and you get just a plate that's just full of food, and you say that you're not hungry and you still get it. I went over to my mom's house not too long ago. She lives here in Belinda, and then she said, do you want anything to eat? And I said, no, I'm not hungry. Okay, well, have a steak. Have a steak. Here's a steak. So that's the mentality that I'm always fighting. But it is something that I'm very passionate about because about 3 years ago, I decided that I used to be about 250 pounds. And I just reached a point when I said, I have to take care of this. I have to take care of my weight because it was getting worse and worse every year. I have 2 young children, and I wanted to make sure that I was around for them in the future. I was starting to notice that it was affecting my joints. It was affecting my energy level, and hormones played a big role in that. Now, in my situation, it was more the stress hormone, but we'll go over a few of the things that can affect weight loss. But at the end, we're mostly going to be talking about bioidentical hormones. So This is kind of an overview, so we're going to understand the purpose and function of a compounding pharmacy. What is a compounding pharmacist? What is it that we do? Review the differences between synthetic and bioidentical hormones. Review some of the symptoms of hormone imbalance, and review how specific hormone imbalances can affect weight gain in both men and women. We'll review steps to achieve hormone balance. We'll talk about customized medications, and actually, let's talk about that now. What is compounding? When you hear the word or the phrase compounding pharmacist, what comes to mind? It's a topic and a subject that many people, at least 10 years ago, were not that familiar with. When Suzanne Summers started talking about compounding and bioidentical hormones, all of a sudden, people started becoming more familiar with what we do. But what we do as a compounding pharmacy goes far beyond hormones. Basically, what we do at our store is we solve medication problems. So all of you, either individually or through family members, have experienced some kind of medication problem. I have an 8-year-old and a 4-year-old right now, and one of the medication problems that they face when they have to be medicated has to do with taste. Kids don't like medication. They don't like to taste medication because it's bitter. So one of the medication problems we help solve for kids is we can flavor medications to make it more palatable. Another common medication problem deals with side effects. Let's take, for example, ibuprofen. All of us here at some point have probably taken ibuprofen for headaches, inflammation, things like that. And what is one of the most common side effects of ibuprofen? Does anyone know? Allergic reaction, but actually stomach discomfort, and it can actually cause ulceration after long-term use of the GI tract. So for these patients that are taking ibuprofen continually for localized pain, say they have an arthritic knee and they're taking ibuprofen to decrease the pain, after using it for an extended period of time, they increase their chance of ulceration. And what we can do is we can take that medication and reformulate it into a cream that can be applied directly to the joint and provide them relief without causing that side effect. So that is what we do, is we solve medication problems, and we do that by customizing medications. We can change the dosage form of a medication. If there's a capsule and someone can't swallow a pill, we can reformulate it into a suspension. If there is a patient that has an allergy to a certain ingredient, say there's a cream that you're prescribed by your physician and you're allergic to one of the preservatives in there, we can reformulate that preparation without the preservative to prevent that allergy.
Here's a question. When you're talking about ibuprofen, do you have to have a prescription for just the strength of an over-the-counter ibuprofen to get it in a cream form? Do you have to have a prescription?
In California you do. That's kind of a state-to-state issue. In California, we're not allowed to compound for over-the-counter use. We can compound dietary supplements. We can compound cosmetic products for patients without a prescription. But when it comes to any drug item like ibuprofen, unfortunately you do need a prescription. But most of the doctors in this area are familiar with this. If you needed something like that, we would contact your doctor for you, and it's very rare that they would deny that prescription. So it is by prescription in our state. There are other states like in Illinois, Washington, where you can actually compound for over-the-counter use, but not in California. So we can change the strength of a medication, we can change the dosage form, and also how it's administered.